is this a therapist that's going to be able to help me is a really big one that I'm seeing a lot right now. The three things that we want to look at when we're trying to figure out if this is a good therapist for them is one, how the therapeutic alliance was, how good that relationship is, how good the fit, how well you're working together with that therapist. Two, we want to get a sense of what kind of treatment they're doing and what their training experience is. There's a lot of different ways to get to become a therapist. You can be a social worker, a psychologist, a psychiatrist, LCSW, LMFT, LPCC, LMHC. There's so many different acronyms. What I can say is there's a couple that stand out to me as someone who's had 4 years of training. And that would be a psychiatrist, so you're going to see MD or DO, or it would be a psychologist, you're going to see PhD or PsyD after their name. So those ones we know have more training specifically in a formal setting. Three, when you're evaluating their training, understand how does that actually apply to your situation. Example with depression, one evidence-based treatment for depression is CBT. A big part of that is going to involve homework, going to involve behavioral activation. If someone is doing CBT and you're like, well, I wasn't doing the homework, they never talked about behavioral activation, maybe they didn't have a lot of experience in CBT, maybe we can get you connected to a therapist who has more training in CBT and who will utilize those kind of techniques and may be a lot more effective for you. For more specific information about actual treatments that fit with actual problems, follow along for more videos.